Hi, everybody. Welcome back to our next episode of Mind Scalpel. Joining us today again is Dr. Kenneth Rothaus from his Upper East Side operating room. Hi, Dr. Rothaus. How are you?
Hi, how are you, Alex? How you doing today?
I'm good. I didn't tell Dr. Rothaus I did this, but I did. And I posted on our Instagram a picture.
Uh-oh.
I
Uh-oh. What
know.
am I
I
gonna
know. Sometimes I get in trouble for this stuff, but I posted a picture of before and afters of a new treatment that we're going to be offering called the Physiq. And the before and after pictures was just before and after pictures. And then there was a question afterwards saying, what treatment do you think produced these results? And the options were Cooltone, Coolsculpting, Physiq, and Emsculpt, which are either fat burning or muscle toning treatments. 90% of the people said that they thought it was Coolsculpting. And then from there it was Emsculpt. And then it was Cooltone. And then it was Physiq. And I think that's interesting because so many people do know about Coolsculpting and not a lot of people know about Physiq. In fact, only 4 people have picked Physiq. And that's what we're going to talk about today is this really great new treatment that combines the power of things like a Coolsculpting with an Emsculpt to get great, really awesome results. And Dr. Rothaus, you've been waiting for the FDA clearance on it here in the US. It's finally come through. It's been cleared in the EU. But now you are one of the first doctors in Manhattan to have it, and it's going to be done down at Modrn Sanctuary with us, which we're super excited about. But I want to know more about it and why people should choose this treatment over maybe just doing Coolsculpting, or who's a good candidate.
That's great, Alex. I didn't know you had done that. I'm surprised 4 people actually picked Physiq because it's so new.
They were all people that know us.
Oh, okay. That makes more sense because you know I've had the device almost a year now. I actually got it like 5 days before we were shut down, and not only were we shut down and I couldn't use it because, as you stated, we were waiting for full FDA approval, but the FDA was understandably a little busy with some other things at the time, so they weren't focusing on devices. Anyway, the other names you mentioned are sort of like the 900-pound marketing gorillas in this arena, Emsculpt and Coolsculpting, certainly. And basically, those are very different devices that have different indications. Coolsculpting uses cold, cryo, to freeze fat in order to get a delayed death of the fat cells called apoptosis, whereas Emsculpt uses electromagnetic stimulation to cause your muscles to contract rapidly, and you get the equivalent of hundreds of sit-ups in a 15-minute interval. And so what that does, that tones your muscles. So for someone who has a little bit of a belly roll or love handles, and they also wanted to give themselves a little more definition and get a little more toning, then up until now they would have to have a session with one of the body sculpting machines, such as the Coolsculpting or the laser devices such as Sculpture or Bliss, and then they would have to go and have an Emsculpt treatment. The downside of that approach was obviously that they had to go to 2 different sessions. The expenses were much, much higher because they were having 2 series of treatments. And so it was time, money, and inconvenience. The Physiq is really an exciting and fascinating device. I wish I had it here, but it's downtown at Modrn. So, but maybe next time we can take a peek at it. But anyway, so Physiq is a device that incorporates 2 energies in one box, and you basically in the same session get treated for both body sculpting and muscle toning. The energy for the body sculpting uses a laser, a diode laser, and the energy for the muscle toning is EMS, electromagnetic stimulation. It is a relatively comfortable procedure. What I also like about the Physiq, besides the time savings and the money savings for the patients, is that it's the heads or the applicators that you put on the patient during the treatment are much bigger than the competing devices. So the competing laser devices. So you get a larger area taken care of with each of the heads. And honestly, most of these the laser devices, patients are charged by the number of heads that are used. So you basically get a savings there because you're covering a larger area. But also the way the laser comes out, it bevels out about 120-degree angle. So you don't get sort of like the cutoff like you or a shark bite look like you sometimes get with coolsculpting, for example, because the only area that's treated is the area that's sucked up inside that device. So it really bevels it nicely, so it's smooth. At the same time, through the same head, you get the muscle toning on it. The procedure can take anywhere from 15 to 30 minutes. It is a series of treatments. We're recommending 5 treatments. They're every 2 weeks. And in certain areas, it's only 15 minutes. The abdomen, which is the most common, and the thighs and the buttocks, we've been doing it for 30 minutes. And that's about the whole thing. The patient, the machine senses temperature of the skin, and it actually automatically adjusts the energy for patient comfort. And in addition to that, we give the patients a little button to press. And if they feel a little uncomfortable and they temporarily want to reduce the energy, they just give it a pop, and the machine reduces it for them. So it's very, very cool, very nice. Patients have been very, very happy with it. And I think if you posted those photos, and we do have, I think we have some photos on our website at rothausmd.com. There's a page for Physiq of the body sculpting, and you can see some of the photos there. And I think, are you going to put it on the Modrn website as well, Alex?
Yeah, I mean, most of it's all going to filter over to your side because it's under the Rothaus side. But I think what's really cool about this treatment as well is looking at the photos is how significant the results are that people are getting in terms of, I know that there's been a whole trend in the Brazilian butt lift. You can see from these photos that there's a smoothing of cellulite, a lifting of the muscles, and a reduction in the fat. It looks great. The other thing that I think, being a mom, you know, after I had my baby, I lost a ton of muscle in my abdomen area, that this sounds like it would be a great treatment for someone like a mom to get their pelvic floor muscles back into play and maybe reduce some of the fat in that area that comes from having a baby.
So I don't think it's going to reach the pelvic floor musculature, but it will help your rectus muscles and obliques, the superficial muscles. Yeah. So you're sort of help your core. What happens to the muscles, with pregnancy is a whole different discussion, but sometimes you can't tone the muscles, but if during pregnancy, if the muscles splayed apart, and we call it a diastasis, if you get that diastasis, even if you tone the muscle, it often won't move it together. And unfortunately, the only way to take care of that is a surgical approach. So I'm not suggesting that's in your case, but I didn't want people listening.
No, that's
okay. Yeah. This would take care of it all.
No, but I'm glad to know there are other options too for that.
There are other options.
That.
Yeah. I think it was a good pickup when you picked up the fact that there was an improvement in cellulite in these patients, because I think that's fairly significant. And cellulite is there's several things that go into why a patient gets cellulite. And I think with this device, because of the heat, there's some skin tightening as well as fat reduction and muscle toning. And I think the combination of the fat reduction with the skin tightening is what helped the cellulite. But that's just an educated guess.
Amazing. Well, we can't wait to come have people try it. I know we've done some amazing show and tell. If you'd like additional information, there is information on how to contact Dr. Rothaus's office or the Modrn Sanctuary office to schedule a consult. Can you do virtual consults these days?
Absolutely. Virtual consults are easy. They just have to go to the website, and there's a little link on top that says schedule a virtual consult, and that's all there is.
Fabulous. Well, Dr. Rothaus, thank you for talking with us about the Physiq, and I can't wait to try it myself.
My pleasure. And it was great talking with you as always.
All right.